Alright, hi there. These are lab values to know for the NCLEX. This information is found on registerednursern.com. So, what are the common blood tests? This is the Metabolic Panel, BMP or CMP. This test can be basic or comprehensive, and it assesses fluid and electrolytes status along with glucose, renal, and liver function. There's a complete blood count, CBC, and that assesses the amount of cells in the blood, platelets, white blood cells, red blood cells, hemoglobin, and hematocrit. ABGs, which is arterial blood gases, it assesses for acid-base imbalances in the body. This test is very important for patients with respiratory or metabolic conditions. Coagulation levels assesses clotting times such as PT-INR or aPTT. This is very important for many blood disorders and for patients who are on anticoagulants. PT-INR is for warfarin. aPTT is for heparin. Lipid panel, which is another name for lipid profile, assesses for the risk of cardiovascular disease by measuring lipoproteins, triglycerides, as well as cholesterol. Hemoglobin A1C assesses average blood glucose level during the past 3 months. It's a great test to check glucose management in patients with diabetes. Drug levels assesses the amount of drug present in the patient's system. Many patients are on drugs that have a very narrow therapeutic drug range. Therefore, this test is helpful in determining if a drug is subtherapeutic or toxic in a patient's system. What to expect on the NCLEX exam with these lab values? On the NCLEX exam, you will be given lab values that are noticeably abnormal. For example, a normal magnesium level is 1.5 to 2.5 milligrams per deciliter. On the NCLEX, it is highly unlikely they will ask you to choose an abnormal lab result of a magnesium level that is 1.4 milligrams per deciliter or 2.6 milligrams per deciliter, because these results are way too close to normal. They will give you something you will notice like less than 1 or greater than 3 milligrams per deciliter. Another important thing to point out is that lab value ranges vary depending on the laboratory. So don't get confused on if one textbook says a normal magnesium level is 1.4 to 2.6 milligrams per deciliter, while another text says a normal magnesium level is 1.5 to 2.5 milligrams per deciliter. Remember to be familiar with the average range, and keep in mind NCLEX will test you on something that is very abnormal. So it's to point out that the normal lab value ranges vary depending on the laboratory. How am I going to remember all of these lab values as a nurse? When you work as a nurse, you will be encountering these labs every day, and pretty soon you will be able to recite them in your sleep. Plus, when you're looking at your patient's results, you will be able to see the normal reference range from the lab that processed the blood specimen. This will tell you the exact normal range and how abnormal this lab result is. So these are the labs to know for NCLEX and as a nurse. Metabolic panel. Glucose is 70 to 100 milligrams per deciliter. Calcium, 8.5 to 10.5 milligram per liter. Chloride, 95 to 105 milliequivalents per liter. Magnesium, 1.5 to 2.5 milligrams per deciliter. Phosphorus, 2.5 to 4.5 milligrams per deciliter. Potassium, 3.5 to 5 milliequivalent per liter. Sodium, 135 to 145 milliequivalent per liter. BUN, 5 to 20. BUN stands for blood urea nitrogen, and it reveals important information about how well your kidneys are working. A BUN test measures the amount of urea nitrogen that is in your blood. Serum creatinine, 0.6 to 1.2 milligrams per deciliter. Total protein, 6.2 to 8.2 grams per deciliter. albumin 3.4 to 5.4 grams per deciliter, bilirubin 0.1 to 1 milligram per deciliter. Bilirubin is formed with the breakdown of red blood cells, high levels in patients with jaundice. The next three values are the three enzymes found in the liver. If elevated, it can indicate liver problems and other diseases. ALP, which is alkaline phosphatase, is 40 to 120 units per liter. ALT, alanine transaminase, 7 to 56 units per liter. AST, aspartate transaminase, 10 to 40 units per liter. So these lab values can be ordered on a blood test, which is ordered on the BMP, which is Basic Metabolic Panel, or the CMP, Comprehensive Metabolic Panel. It is the CMP which will include the liver function. Next is the complete blood count. RBCs is the red blood cells, 4.5 to 5.5 million. WBC, white blood cells, is 5,000 to 10,000 per microliter, I think. I just googled it. And then platelets is 150,000 to 400,000 per microliter of blood. Hemoglobin is 12 to 16 grams per deciliter for women, 14 to 18 grams per deciliter for men. Hematocrit is 37 to 47% for women, 42 to 52% for men. Arterial blood gases, ABGs. The normal pH range is 7.35 to 7.45. PCO2, 35 to 45 mmHg. mmHg stands for millimeter of mercury. HCO3, which stands for bicarbonate, is 22 to 26 milliequivalent per liter. PO2 is 80 to 100%. O2 saturation is 95 to 100%. Coagulation levels. INR/PT. PT stands for prothrombin time, which is 10 to 12 seconds. This is the normal level for patients not on warfarin. INR, which is the international normalized ration, less than 1, which is the normal level for patients not on warfarin. When a patient is taking the anticoagulant warfarin, the INR should be 2 to 3. The INR level is calculated from the PT level. aPTT, which is the activated partial thromboplastin time. The normal is 30 to 40 seconds for people not on heparin. If the patient is on heparin, the aPTT needs to be 1.5 to 2.5 times the normal range. Lipid panel, which indicates the risk for cardiovascular disease. LDL, which is the low density lipoprotein, less than 100 milligrams per deciliter. You want this value low. HDL, which is high density lipoprotein, greater than 60 milligrams per deciliter. You want it high. Total cholesterol, less than 200 milligrams per deciliter. Triglycerides, less than 150 milligrams per deciliter. Hemoglobin A1C, you want this 4 to 6% target for patients without diabetes, less than 7% target for patients with diabetes. Drug level ranges. Digoxin, 0.5 to 2 nanograms per milliliter. Carbamazepine, 4 to 10 micrograms per milliliter. Dilantin, 10 to 20 micrograms per milliliter. Theophylline, 10 to 20 micrograms per milliliter. Phenobarbital, 15 to 40 micrograms per milliliter. Lithium, 0.5 to 1.2 millimole per liter. Valproic acid, 50 to 100 micrograms per milliliter. The references for this information was the blood tests, National Heart, Lung, and Blood Institute, NHLBI, 2019, retrieved from their health topics/blood tests, National Institutes of Health, 2001, National Cholesterol Education Program, ATP 3 Guidelines at a Glance Quick Desk Reference ebook, page 1 to 2, the A1C test in diabetes, NIDDK, retrieved from the niddk.nih.gov/health information/diabetes overview/tests diagnostics/A1C test, and the U.S. Department of Health and Human Services, NIH, Understand Your Complete Blood Count and Common Blood Deficiencies ebook, page 1. So all this information is on registerednursern.com/labs to know for NCLEX review. This website also has a quiz that you can review for the type of information that could help you pass the NCLEX. I hope this information helped, and best of luck, and I wish you good health.